This is Unit 20, Part E, Control of Breathing. Under control of breathing, we'll look at the respiratory center, rhythmical control, and rate and depth control. Respiration is controlled by transmission of nerve impulses from the brain to the muscles of respiration. Conscious control involves the cerebral cortex. Unconscious control involves the respiratory center. This is a scattered group of neurons in the medulla and the pons. The respiratory center has four components. There's an inspiratory area that transmits impulses by inspiratory neurons. They're mainly in an area called the dorsal respiratory group. There's the expiratory area. This transmits impulses by expiratory neurons, and these are found mainly in an area called the ventral respiratory group, VRG. There's a pneumotaxic area, or pontine respiratory group, PRG. This is linked to the other areas. And then there's an apneustic area, linked to the other areas as well. Not a lot is understood about these last two areas. Respiration is due to rhythmical activity of the inspiratory area. Each respiratory cycle lasts roughly 5 seconds at rest. Inspiration takes roughly 2 seconds, expiration 3 seconds. The average respiratory rate at rest is 12 per minute. We want to look at control of rate, that is how fast, and depth, how deep, involved in breathing. We'll call it R and D. Of course, there's voluntary control. There is carbon dioxide control and control by way of oxygen levels. The cerebral cortex, of course, controls voluntary breathing. So you can voluntarily inhale and exhale and hold your breath. The inspiratory area receives input from chemoreceptors, which we'll describe in a moment. It also receives input from stretch and contact receptors in the air passageways and pain receptors in tendons and ligaments. The expiratory area receives input from higher centers, such as the cerebral cortex. Carbon dioxide control requires carbon dioxide chemoreceptors located in the carotid sinus area and in the aortic sinus. There's also a chemosensitive area in the medulla that comes in contact with the cerebrospinal fluid. First two of these sites are located in the same general area as the baroreceptors discussed earlier. The receptors transmit information by way of increasing nerve impulse frequency to the respiratory center. Carbon dioxide control happens to be very sensitive to CO2 levels in the plasma. CO2 receptors are actually hydrogen ion receptors, because you remember carbon dioxide in solution produces hydrogen ions. Hydrogen ions cannot cross the blood-brain barrier, but carbon dioxide will. And so once it crosses the barrier and reaches the cerebrospinal fluid, it's transformed into hydrogen ions. Increased carbon dioxide levels cause increased rate and depth of breathing. Now, it turns out the receptors for CO2 are very sensitive. It turns out a 5 millimeter increase in pCO2 can cause a 100% increase in respiratory rate. Decreased carbon dioxide, in turn, causes a decreased rate and depth of breathing. What about oxygen control? This requires oxygen chemoreceptors, which are sensitive to partial pressure of oxygen in the plasma. These as well are located in the carotid sinuses and the aortic sinus. But there are no oxygen receptors in the medulla. Decreased oxygen leads to an increase in rate and depth of breathing. Increased oxygen causes a decrease in rate and depth of breathing. I mention this for a very important reason, as you'll see. The receptors are less sensitive than the carbon dioxide receptors. Oxygen control becomes important when PO2 levels are very low or carbon dioxide control mechanism fails. There's a condition, a disease called COPD, which stands for chronic obstructive pulmonary disease. It includes such conditions as emphysema, asthma, chronic bronchitis. It restricts the movement of air into the lungs, hence the name obstructive. Here's a question. What will happen to breathing if a COPD patient is given pure oxygen? The answer is it will slow or even stop breathing. Now imagine you're working in the ER, a patient comes in respiratory distress, is having trouble breathing because of one of these conditions. You have a tendency to slap an oxygen mask on the patient, and all you do is slow down the breathing. It might even be fatal for the patient. Anemia, a different condition, this is due to a decrease in hemoglobin or red blood cells. So the tissues are not getting enough oxygen to carry out their normal functions. Another question, does anemia affect oxygen receptors and the control of breathing? The answer is no, because anemia is due to a deficiency of oxygen in the red blood cells, whereas breathing is controlled by oxygen dissolved in the plasma. That's the PO2 we keep talking about. Take a look at this beaker. Let's take a beaker of water and put in it a red blood cell. And notice there are oxygen molecules inside the red blood cell and in the beaker. Question number 1. Which number represents PO2? That would be number 2. That's the partial pressure of oxygen dissolved in the fluid. Question 2. Which number represents oxyhemoglobin? Well, that would be number 1. That's the oxygen in the red blood cells bound to the hemoglobin. Question 3. Which number represents the oxygen sensed by oxygen receptors that are involved in the control of breathing? That would be number 2. The free, loose oxygen molecules that bump into the receptor and stimulate it. Question 4. Which number represents oxygen affected by anemia? That would be number 1. Remember, anemia is a decrease in hemoglobin or red blood cells, which would, of course, decrease the oxygen present in the hemoglobin. There are a few other factors that influence rate and depth of breathing. For example, the lung has stretch receptors. These are stimulated when the lung becomes overinflated. At one time, it was thought they were important controllers of regular breathing. It was thought that a person inhales, receptors are stretched, that stimulates the expiratory center to exhale. But it turns out these stretch receptors are more involved in protecting the lungs if there's damage to the chest wall, so the lungs won't rupture. They transmit impulses by way of the vagus nerves and inhibit the inspiratory area. They're also called the inflation reflex or the Herring-Breuer reflex. There are pain receptors and stretch receptors in the joints that affect breathing. Sudden pain stops breathing, called apnea. At the beginning of exercise, skeletal muscle and joint movement stimulate respiratory centers to cause an immediate increase in ventilation. There are other effects. Increased body temperature causes increased rate and depth. Irritation of the pharynx will cause apnea. And that is a look at the respiratory system. You're now ready to continue on to Unit 21, the excretory system.